Learn how the heart anatomy all comes together in under 15 minutes. Hi everyone, my name is Dr. Jared Berkey and I'm a medical doctor based in the UK. Today we are going to sketch and explore the heart. Let's start off our journey through the heart by entering the right atrium. The great veins known as the superior vena cava and the inferior vena cava return blood from the upper and lower body respectively. Now the right side of the heart consists of the right atrium and the right ventricle. Beyond the right ventricle lies the pulmonary trunk or pulmonary artery. This is the only artery that sends forth the oxygenated blood from the heart. Separating the right atrium and right ventricle is the right atrioventricular valve, known as the tricuspid valve. The pulmonary valve is the other right-sided heart valve and is classified as a semilunar valve. It separates the right ventricle from the pulmonary trunk. Once full, the ventricles contract, which is known as ventricular systole, forcing the tricuspid and mitral valves to close. This produces the first heart sound. Aortic and pulmonary valves open shortly after, and their subsequent closure at the end of contraction of the ventricles produces the second heart sound, the dup. The left side of the heart also consists of one atrium and one ventricle, separated by another atrioventricular valve. This is known as the mitral valve. The aortic valve is the other semilunar valve and guards the entrance to the aorta from the left ventricle. Blood flows through the atria and down into the ventricles before being expelled out through contraction of the ventricles. With the left atrium, in contrast to the right atrium, the blood received is in high oxygen, having just returned from the lungs, from the pulmonary circulation. The right side of the heart is the origin of the pulmonary circulation, and this circuit continues through the left atrium and through to the left ventricle. Thus we can see two connected circulations, the pulmonary circulation and systemic circulation. As the left ventricle has much further to push its volume of blood, its wall is especially thicker and more powerful. Heart failure can involve the left side, right side, or both ventricles of the heart. When we speak of heart failure, we usually refer to the condition starting with the left side, the left ventricle. However, we can also talk about systolic heart failure, where the heart muscle is too weak to pump blood, and diastolic heart failure, where the ventricle does not relax and refill properly due to stiffness. Diastolic heart failure is also known as heart failure with a preserved ejection fraction. Ejection fraction is the volume of blood expelled through the aortic valve with every contraction of the ventricle. The dominant cause of heart failure is coronary artery disease, also known as ischemic heart disease. Other causes of heart failure include high blood pressure, cardiomyopathy, valve disease, and metabolic conditions. Right-sided heart failure can arise secondary to left-sided heart failure, and this is called congestive cardiac failure. As left-sided heart failure worsens, there is a build-up of blood in the pulmonary veins and lungs. Pulmonary edema is the build-up of blood in the lungs, resulting in fluid accumulating in air sacs, inhibiting the gas exchange process. As mentioned, valve disorders can contribute towards heart failure, but this is becoming less common in developed countries. Rheumatic fever used to be a common cause of mitral and aortic valve disease. All four valves are shown together here. Now, in developed countries, the aortic valve disease, known as aortic stenosis, accounts for the majority of valve conditions. Aortic stenosis is a narrowing of the aortic valve that results in reduced blood flow to the systemic circulation, and it eventually leads to compromised left-sided function of the heart if untreated. Therefore, it is essential for aortic stenosis to be assessed and considered for surgical intervention. Cor Pulmonale is a condition that causes the right side of the heart to fail. It relates to long-term high blood pressure in the arteries of the lung, so it's a pulmonary cardiovascular problem. This high blood pressure in the arteries of the lungs is called pulmonary hypertension. It makes it hard for the heart to pump blood through the lungs, straining the right side of the heart. Lung conditions that cause low blood oxygen level over time will lead to Cor Pulmonale. Shortness of breath and lightheadedness during exercise are the first symptoms of Cor Pulmonale. Palpitations may arise, and over time symptoms occur with lighter activity and even at rest. These can include considerable fatigue, swelling of the ankles and feet, fainting with exertion, chest pains, swelling of the neck veins, which is from pressure transmitted from the superior vena cava and the right side of the heart, pitting edema of the ankles, and abdominal swelling with liver swelling from the inferior vena cava pressure. The aorta is divided into three parts: the ascending aorta, the arch of the aorta, and the descending aorta. The ascending aorta is the immediate region leaving the heart and points to the head. It has two small branches called the left and right coronary arteries, which supply blood to the heart muscle. The arch has three branches: the brachiocephalic artery, which further divides into the right common carotid artery and the right subclavian artery. Then there is the left common carotid artery, and lastly the left subclavian artery from the arch. Talking about the conduction now, the heart has very specialised conduction cells that naturally produce and propagate action potentials through specific pathways. When we refer to biological action potentials, we refer to the movement of sodium, potassium, chloride and calcium through special membrane channels at a molecular level. Now the sinoatrial node generates its own action potential. An action potential, otherwise known as an electrical impulse, initiates muscle contraction. The sinoatrial node sends the action potential through internodal pathways along the right atrium. The action potentials quickly reach the Atrioventricular Node, or AVN, and from here, the AVN sends impulses through the bundle of His and along branches either side of the heart. They spread along the Purkinje Fibres and through the heart muscle, stimulating coordinated contraction. Impulses travel in such a way that papillary muscles involved in valve closure are prioritized ahead of the ventricular muscle tissue. This allows for blood to flow in one direction. Thank you for watching. If you like this video, remember to subscribe and click on the notification bell so you don't miss out on any of the latest videos.